thanks so much for joining us on Speaking of Making Healthcare Work for You. I'm Stephanie Fields. I'm joined by my co-host, Dr. Apurv Gupta, and our guest today, James Dold, who is on the leadership and development team of Mindoula, and he is a behavioral health specialist. So thank you both for being here and joining me today.
Pleased to be here.
Thank you, Stephanie.
So James is going to talk to us about behavioral health and all of the impacts that COVID is having on it, and then just the greater picture of behavioral health in the US. So James, why don't you tell us, why is this important to you? Where did your interest in this start, and why does it matter? Why is this so important?
Yeah, so I'm a behavioral health nurse by training. I've been in healthcare for, 30 years. Dr. Gupta and I met probably 15 or 16 years ago here in Boston with NIQA. But out of nursing school, I went in nursing school as a paramedic, got into trucks with other big guys and got a lot of behavioral health calls to get patients managed into the ED for evaluations, and really found a passion for talking patients off of ledges, quite frankly, and out of doing foolhardy things to get them into a safer environment. That kind of lit my fire around behavioral health and the opportunity for me to impact patients. If you talk to my father, who's been gone quite a few years now, he'll tell you that I was made for it because I grew up in a crazy household. Right? We're all kind of crazy, but truth be told, it was my passion. I fell into it and I just fell in love with it. The ability to walk into a room at 6'1", 295, and talk people out of doing crazy stuff and talk them into a better place was a lot of fun, and I got a lot of enjoyment out of it. And through my experiences, I've been able to grow and develop and leverage my psych background into the behavioral health space, and then into primary care and other aspects of the medical continuum.
That's awesome. And I love your personal connection to that, because that's so great. And like when you said you literally can talk people off of ledges, and being a big guy, you have that ability to really help people when they're having a physical struggle, which is amazing. And then I love that you're so interested in getting into their mind and figuring out what's really triggering that, because it's not just, some random thing. There is an underlying issue. But before we started the interview, we were talking, and you said that there's a huge crisis in the ability for people to actually get help even when they need it. So tell us, how big is this problem?
There is. If you think about it, in the work we're doing today around trying to figure out how to scale behavioral health needs into the community, if you think about the behavioral health network, psychiatry in particular, nationally, about 26% of psychiatrists in the national footprint are accepting new patients. And if you think about that number, you're waiting up to 14 weeks for that appointment to take place. So if we do the math on that quickly, if you are having a very, very difficult life crisis and need an acute bed someplace or to talk to somebody urgently, where are you going to go? What are you going to do? You can't solve for that overnight. If you do those numbers out even a little further, 36% of patients with a behavioral health need actually receive care, which means there's a gigantic delta out there of patients who just don't either want to address it or don't know how to address it. And of that 36%, only 12% are receiving care from actually a psychiatrist or somebody with psychiatric training per se. So it really highlights the depth of the need. And if you think about the broad spectrum of just the Medicare Advantage population at large, 28 to 44% of those patients in the Medicare Advantage space over 65 have behavioral health needs that are not being met or being underserved. So the needs are real, and they're significant, and they're getting worse by the day.
I was just going to ask, is that a situation that it is getting worse, or is it that we're more aware of it and we're trying to treat it better? And then why are only 26% of psychiatrists accepting new patients? Is it because they're booked to the max?
It's actually, so it depends on who you talk to. I was speaking with a large national payer here in the Boston market a few weeks ago, and they're saying the majority of their psychiatric physicians in their network are in private practice doing private pay, and they can't get them to engage across some of these continuous improvement programs in the community, like collaborative care. They can't get them to think differently about how to approach psychiatry and how to spread that into the marketplace. I don't think that the needs of behavioral health have necessarily spun out of control. I think the need for behavioral health has been rather consistent throughout our lifespan. I think what's happening today is there's a better focus on it, right? We see a lot of engagement around celebrities and sports figures who are doing a great job publicly of acknowledging the challenges and the struggles of both things like depression and bipolar disorder and others. that highlights the problem and actually encourages people to seek treatment. That's driving some of the challenges we have around access. The other issue I think we have is, I hate the word unprecedented times. It actually makes me cringe because everybody says that. But you have really the perfect storm of issues taking place with the election craziness that's been taking place over the last really 3 years. COVID now taking place, going on almost a year at this point. The next month will be a year. People don't know what to do. Everywhere they look, there's something else that's causing them anxiety. So you have this whole cohort of patients who, I call them the walking wounded, right? They were the walking well. They had depression, anxiety that was manageable on their own. You throw into these other events into the life they have no control over, and they really begin to spin out of control. And then they don't know where to go to get the help they need because they can't wait 14 weeks for medication. And unfortunately, most primary care doctors, and again, grain of salt, I say most, they're not necessarily comfortable prescribing psychiatric medications for good reason, right? And that's not necessarily in their wheelhouse. And there's a lot of additional responsibility that comes from those diagnoses. And if there's no access in the marketplace, they're holding the bag and responsible for the mental health and well-being of that patient when they're really trained as an internist and to focus on the entire body and not the mind necessarily.
Yeah, so James, it's interesting. One thing you said, I wonder if you can clarify. In general, it feels like we're hearing about behavioral health, mental health issues everywhere at school-age kids, college-age kids, in every aspect of society. So is that just really more increased awareness, or is there something happening that's actually increasing the sense of anxiety, fear, isolation? Because from your prior comments, I got a sense that maybe you think it's a little bit of just more exposure, but I'm wondering, is something growing within our society as well that's causing more of these issues?
Yeah, I think it's both, right? I think if I look back to my college years, there was certainly a lot of angst and uncertainty in the environment that we were going through. But you always knew at the end of your college years, you were going to find a job and move on, right? I think if we think about the youth of today, and I think my 14-year-old down the hall, homeschooling, wanting to get into robotics and taking Mandarin and working 7 days a week to compete at MIT because he's not, in that genre of kids who can get in there very easily. Very stressful. He knows what his grades are day to day. Hour by hour, he can tell you what his grades are. He falls below an A-, he starts to freak out. So I think, if I go back to my school days, grades came out 4 times a year. You hoped it was a decent grade set so your folks didn't get aggravated with you. But now if he wants to compete on the world stage, he knows day to day that he's, looking at MIT is where he wants to land. He may not get in if his grades aren't, A's across the board and he can speak Mandarin and has his, Eagle Scout and all these other things. So I think the stressors are more real for the kids today because of the immediacy of our environment. I think the internet's a fantastic thing, but it's also adding a lot of stress to our children.
Yeah, such a good point. Such a good point. So, and it strikes me then that obviously psychiatrists alone are not going to be able to solve this, right? So obviously there's a huge shortage of psychiatrists, but you're going to need a lot more solutions and many other kinds of providers and probably changes at the societal level in order to really address this.
Yeah, absolutely, right? You can't fix this with one answer. You just can't add a bunch of psychiatrists and solve the problem, right? It's a systemic issue. We're boarding in the emergency department psych patients because there are no beds. There's no access, right? You can't fix the access by adding more beds because you need more staff to manage it that are trained. So there's really a cart before the horse, the chicken before the egg, pick your crazy story there. The problem is really systemic. We have to really have a multifaceted approach to solving this problem. A lot of the work that I'm engaged in and having conversations all over the country is trying to figure out how to leverage, new things like this collaborative care model and community-based behavioral health approaches, where we can spread psychiatry, which is very thin, across a broad spectrum of the marketplace. And how do we reinforce our primary care providers and give them a backstop to feel more comfortable prescribing, antipsychotic and psychiatric medications for the population at large?
Could you break that down, James? Because what you just said is what you and I have been discussing, and it's so powerful. But at the same time, we're thinking about doing that in the context of health systems and consulting. Could you help explain that collaborative care model to the layperson? What is it exactly, and how would it benefit them?
Sure. So let's make it really simple. Let's take me, James Dold. I go to see my primary care physician, and he recognizes that I am more stressed than usual when I go to see him based on my blood pressure or whatever else, and just through our conversation. he can make a recommendation to me and say, hey, you know what? I think if you're open to it, I'd like you to talk to a behavioral health specialist, not a psychiatrist, not a therapist, just a behavioral specialist. I want you to take this assessment. We do this assessment and see what it tells us. Sit down, talk with a behavioral health nurse practitioner, goes through my history, asks me a bunch of questions, takes about 60 minutes or so. Through that assessment, make recommendations back to the primary care around medications, around treatment modalities, around potential therapists, all done under the umbrella of a consulting psychiatrist. PCP says, you know what? I think it's great. I think you could really use the help. I might be stressing about a job change. I might be stressing about how to manage my kids at home and work full time and help them manage school, life stressors, COVID, take your pick. And it could be that talking to a behavioral health specialist, a social worker, a couple of times a week might help offload some of that anxiety, some of that stress, along with an antidepressant or an anti-anxiolytic to just take that edge off and make me more open to discussions and conversations and think about things a little more clearly, right? Could stay in that collaborative care model 2 months, 6 months, 8 months. Beyond that episode, if things go back to normal, I can go back into my normal daily routine. Thank you for the help and continue on. The great news is that through testing done through an app, through the telephone, right? Everybody's got a smartphone today. I can take ongoing assessments in my free time. And if my care team sees a change in my status through these online tests and evaluations I take, they just pick up the phone, dial me back in and say, hey, how you doing? We saw that your test went up 4 points last week. Everything okay? Should we, have another conversation and talk about some of those things that were bugging you before? So a real true capacity to dial up and dial down the level of engagement based on very simple tests that are done over the phone through smartphone technology.
Stephanie, how does that strike you?
Obviously, a psychiatrist can prescribe medications because they are medically trained doctors. And then in the collaborative care model, you mentioned people working underneath the umbrella of a psychiatrist. Mm-hmm. So what is the role of somebody that people might be more familiar with in their daily life, like a therapist that they'd see or a psychologist? How do those people factor in?
It's really based on the level of need, right? So not everybody needs a therapist. Not everybody needs a psychologist. Psychologists and therapists are extremely important in the process, and the ability to get into a room and talk in a free, safe environment about the issues of the day are incredibly impactful to everybody who does it. But not everybody needs a level of engagement, right? It could be that talking through a behavioral health trained social worker, a licensed social worker, could get you the blocking and tackling, the community-based assets and resources you need to overcome those very episodic challenges you're facing. Certainly for the population who needs a therapist and it needs that talk therapy, it needs that safe environment to bounce ideas off of and get different framing around the life events they've got going on. A therapist, psychologists are absolutely in the mix in this model, but only if it's clinically indicated. And that's another way we can actually insulate the overutilization of the network and really make sure that we're assigning the right level of care to the right patient at the right time.
Thinking of MTV, Dr. Drew at the reunion specials often says, or things like everybody could use therapy or everybody can benefit from therapy. Yeah. So are you saying that maybe that's not the case and that people shouldn't be doing that because they're overutilizing the system and taking away from the true need cases?
So let me be very clear. Everybody could use therapy, but not everybody needs therapy from a therapist or a social, a psychologist. Mm-hmm. Licensed social workers do a type of therapy as well. They're able to help talk through and provide solution sets at a different level, right? We're really making an effort to dial in the right level of engagement for the right type of problem patients are having. Mm. Right? It's like you don't have to go to the emergency room for every problem you have. That's why we've had Minute Clinics and Walgreens spin up these walk-in retail centers that magically treat appropriately 96% of the patients who show up are appropriately self-diagnosed and come into those locations, right? That was a help to our EDs in terms of offloading some of the burden that they had from an urgent perspective.
So is that the same type of model that we should be using in behavioral and mental health, that same type of education and awareness to help people get to the right place and use the tools that you mentioned?
Absolutely, right. There's a lot of great work happening right now. And some of the things we're hoping the Biden administration will do is do things like investing in public media campaigns around how to leverage and what to leverage in the behavioral health continuum and how to access services, right? So that we can, A, be good stewards of the healthcare system, right? We got to remember that we waste $1 trillion every year of healthcare spend. Patients who have an underdiagnosed or undermanaged behavioral health need with chronic conditions, comorbidities, we call it, like diabetes, hypertension, heart failure, these things, all of our elders tend to kind of walk into. They spend almost 300% more on those chronic conditions if they have an undermanaged behavioral health need underneath, right? Because they're overwhelmed with their depression or their anxiety. We'll use those two as our kind of speaking points. So it prevents them from seeking care timely. It prevents them from being medication adherent and taking the meds as prescribed by a physician, not even taking into account that there's potentially some funding challenges there that might preclude them from taking meds appropriately as well.
These days, we hear a lot about healthcare coaches who are not specifically trained psychiatrically. Do you think that they have a role in this system?
They do have a role, right? I think everybody has a role. I think it really depends on the proper stratification. And what I mean by that is we really truly understand the need of the population, right? Because some of the needs patients have could be very well managed by a health coach. Somebody who's not trained, but not trained to the same level as a social worker or a therapist or a psychologist. I think of it as kind of a medical assistant in an office practice setting, right? Somebody who comes in as the first line of defense, does some basic questioning, does a PHQ-9, a psychology test, and get some results and make sure that they're on the right path. There's definitely a place for coaches. I think a lot of that coaching responsibility we're seeing pivot to online tools that allows us to query the data at scale and actually evaluate responses over time in a neutral environment, letting the data speak to us around who needs more services and when.
I actually did the survey on the Mindoula website.
Oh, that's great.
Assessment, and it was really cool.
I haven't got you as a referral yet, so you must be fine.
I did. I actually scored very low, so I will be sure to let my husband know because he probably has some other thoughts.
You didn't take the option to let him test for you?
That's excellent.
No, I didn't. No, he might score me higher. But no, it was really cool. And I like that those things that was so available and open on the website that you just go there. And I think things like that are so important because if somebody is struggling, that could be a first step that they take without having to tell anybody. It just gives them an easy, free access. And then maybe, if it would have been a high score, I would have been like, oh my gosh, now what? Now maybe I do need to see somebody else. Maybe I need to talk to somebody about this.
Yeah, here's the good news. If you're actually in the Mindoula system through one of our contracts and that score comes back and pops high, you're in the queue, right? You'll be receiving an outbound phone call from somebody who's paying attention to the data on the back end to make sure that you are actively being engaged and we're not overlooking that opportunity, right? As we say in the healthcare inpatient side of the equation, EMRs are fantastic, but it's really garbage in and garbage out. You got to make sure you're doing good things with the data you get in there, because it can't be for naught. And that gets us to the screening piece, right? The other thing we should be looking to the Biden administration to do is really increase screening across the board, right? And it's not just, we hear about screening for COVID, which is incredibly important. And we see the numbers tell us the great story about them coming down over the last month by 100,000 cases. But what if we tied that screening component of your COVID test to the test you took on the Mindoula website? Think about that at scale. Think about us over the next 12, not even 12 months, the next 10 months, screening all 300 million Americans around behavioral health needs and then doing something with it.
This is really intriguing what you're proposing. So you do a COVID screening and you do a behavioral health screening, and they must be connected, right? Are there people that are more likely to score high on a behavioral health screen, also likely to have some challenges on the COVID side?
So just me speaking without looking at the data, but I'm going to just go on the straight data that's out there today, that 45 to 50% of the population has an underdiagnosed behavioral health need, right? Add to that list the patients with chronic conditions like diabetes, hypertension, heart failure. You combine those two and you're reaching a very, very solid 60% of the population who is going to have a need that we could help with, right? And it's that those chronic conditions, if you're struggling with your management of diabetes because you're in the house and can't get to the right food or the right appointments or the right type of exercise, you can't get to your heart failure specialist, you're stressing out eating the wrong food. All of these things are intertwined, right? And we can't address one without addressing the other. So it's really a global approach is, I think, the only way we can move forward.
I like that idea of having something that you're doing anyway with the COVID test or the COVID vaccine rather, and then getting the behavioral health screening at the same time, because it's not something that requires an additional step. It's not something that requires additional money on the behalf of the payer, because any of those barriers that you can remove, the better. But I do wonder about people who might be resistant to this. There are people who don't trust the vaccine, and then you add a behavioral health screening. Is that going to be something that then they're going to think, is really overtaking them? How do you come at it from an approach of genuine love and care so that they understand and they're not suspicious of the motive behind it?
That is the $1 million question, right? And I think that as you've seen, the testing and the evaluation is quite easy. It's quite simple. It's very non-threatening. And I think that's the key piece of the equation, right? We can't come at this and say, we think you have a behavioral health need. It's really, we understand these are stressful times. And our recommendation to everybody who's taking the COVID vaccine is that you take this additional screening tool and allow us to make sure that there isn't anything else going on we should be helping you with as you move beyond COVID into the next phase of this lifespan, right? Which is post-COVID, but it's also stressful. The economy's not going to spin back. I heard numbers today for another 4 years, the level of employment we had prior to COVID hitting, right? So just because the vaccine's out and, knock on wood here, everybody who is open to getting it and can get it by midsummer, let's say, that's great. We've got some herd immunity moving on us and we're beginning to rebuild the economy, but we're still 4 years away from where we were just a year ago from an environment perspective.